We often hear about oxytocin, dopamine, and serotonin as the big three chemicals controlling our sex lives, but most of what's said about them is misleading. The truth is, your most powerful sexual organ isn't between your legs, it's between your ears. Your brain directs everything from the spark of attraction, to the rush of arousal, to the deep sense of bonding after intimacy. Understanding how it works not only clears up common myths, but can also transform how you view your own sexuality. One of the most fascinating findings in sexual neuroscience is how strongly early experiences shape our preferences. Those first encounters with pleasure can create a kind of blueprint, sometimes called a love map, that influences what we find exciting later. If the experiences are positive, the brain tags them as rewarding and encourages us to seek them out again. If the experiences are negative or unsatisfying, the brain can store those too, sometimes making it harder to enjoy intimacy later. But the good news is the brain is highly adaptable. With new positive experiences, those templates can be reshaped, opening the door to different kinds of pleasure and connection. Dopamine is one chemical that's often misunderstood. Many people believe orgasm is a huge explosion of dopamine, but research shows the opposite. Dopamine peaks during arousal, then actually decreases at climax. Its real job isn't to deliver pleasure itself, but to motivate us to pursue it. In other words, dopamine is the drive that keeps us moving toward what we desire, and nothing activates this drive more powerfully than human touch. Studies show that touching yourself raises brain activity more than simply viewing sexual images, and a partner's touch is even more powerful. That's because the skin contains special nerve fibers that only respond to another person's touch, something no device or screen can duplicate. As arousal builds, your brain is in overdrive. Visual centers activate to process what you're seeing. Emotional areas like the amygdala prepare for reward, and higher-level thinking regions narrow your focus to the goal of intimacy. Right before orgasm, something fascinating happens. The brain enters a unique state of reduced cognitive control and heightened sensory awareness, almost like a flow state or meditation. Then, during climax, the hypothalamus releases oxytocin, cementing feelings of bonding and connection, while the brain's motor centers trigger rhythmic pelvic contractions at a precise 0.8-second interval. Interestingly, orgasm isn't something we're born automatically able to do. It's a learned brain state, shaped by those first few experiences. After orgasm, the story isn't over. What happens in those moments after sex plays a huge role in shaping connection. Cuddling, kissing, or simply staying close helps the brain anchor those neurochemical signals into a deeper bond. Without that closeness, the brain may not reinforce the attachment as strongly, which is one reason casual encounters can feel unfulfilling. On the other hand, lingering with your partner, sharing touch, warmth, even sleep, can transform a single experience into the foundation of a lasting relationship. This brings us to one of the most debated topics, pornography and masturbation. There's a widespread fear that they damage the brain, numb responses, or ruin real relationships. But scientific research paints a more nuanced picture. Watching porn does activate the brain, but not nearly as strongly as touch or real-life intimacy. People who watch more porn often simply have higher sex drives, and there's little evidence that it prevents bonding with a partner. The real issues often come from guilt, shame, or strict abstinence-only mindsets. In fact, when people set unrealistic zero-use goals and then inevitably relapse, they can experience intense shame, distress, and even harmful thoughts. The healthier approach is learning to align behaviors with personal values, rather than punishing yourself for normal sexual curiosity. Sexuality, after all, thrives on variety and exploration. Just as in other areas of life, routine can become dull, and seeking novelty, whether through fantasy, role, play, or yes, even pornography, is part of being human. Problems arise only when it starts to replace real connection or interfere with daily life. Otherwise, as long as experiences are consensual, safe, and enjoyable, there's no reason for shame. At its core, sex is about the brain, the way it learns, adapts, motivates, and bonds. By understanding this, you can begin to see sexual pleasure not as something mysterious or taboo, but as a natural function of your most complex organ. And perhaps most importantly, you'll realize that intimacy is more than just a physical act. It's a deeply neurological dance of chemicals, emotions, and memories that shape how we love, connect, and find joy with others.